When we walked in to the hospital, I could notice that what had been happening in Shifa was happening at al-Ahli hospital. The hospital was turning into an internally displaced camp. There were lots of children and families in the grounds of al-Ahli hospital. I went, I saw the patients, made a decision whom to operate on, made a list of 10 patients that needed surgery that day and another 10 that needed surgery the following day. And around 12 o'clock that morning, we had a visit from the CEO of the hospital and the medical director, Dr. Maher Ayad. What had happened in the days before is that also Dr. Maher Ayad had received a phone call from the Israeli army ordering him to evacuate the hospital. A day later, when he didn't, the Israeli drones fired 2 missiles at the fence of the hospital. And then he had received a second phone call from the same officer berating him for not having evacuated and telling him that unless he evacuated, the hospital was going to be hit. The reason why we had the visit from the management team is that they told us they had been in touch with the bishop in London and that he had received reassurances that we could carry on our work. By 5 o'clock, I had made this decision that I needed to operate into the night and start early in the morning, and upon discussion, we made a decision that I would stay over and continue working at al-Ahli. Later on that evening, between having wheeled out one of the patients and we're about to bring the next patient in, and there had been in the few hours before a lot of bombing around the hospital and you could kind of feel it shake. There was an almighty whistling sound coming towards us, kind of indicative of missile, and then a huge explosion. It was obvious from the size of the explosion and the damage that it was either at the edge of the hospital or within the hospital. The false ceiling in the operating room fell on top of us. Luckily, I wasn't injured, and I walked out of the operating room into a corridor that you could see the forecourt of the hospital in, where the families I'd seen the families earlier on. The ambulances were on fire, some of the cars were on fire, and the forecourt, which had been lit by that fire, was full of bodies and parts of bodies. I made my way through, and you saw some of the video there. That's a video that I took at al-Ahli, through the survivors trying to get to the other end of the hospital. I went to the emergency department. The first patient that I saw on my right was a man in his mid-50s with an amputation at the level of the mid-thigh, similar to those guillotine amputations that I was telling you about. And there was blood spurting through the exposed arteries in his stump. I took his belt and tied it as a tourniquet, and then set about trying to find someone's shirt to take it and tie it as a second tourniquet, and try to resuscitate him. Once I was satisfied that he had been stabilized, I moved on to another patient who had received a single shrapnel to his neck, and that shrapnel had hit one of the vessels in his neck and blood was spurting out of the neck. I put my hand on the wound to try to stop the bleeding and found someone else to put their hand and started resuscitating that patient. While I was resuscitating the patient, the ambulance staff started to arrive, and I had a tap on my shoulder, looked behind, and there was a stretcher with some paramedics. We moved him to the stretcher. I kept my hand on his neck so that we'd stop the bleeding and helped carry him outside, and we walked out into the forecourt to try to get to the ambulances. And that's when I saw the full extent of the carnage in the forecourt. Not only were there lots of dead bodies, but there were also parts of bodies, and I remember walking past the amputated forearm of a child. I took him to the ambulance. I then went with him to Shifa Hospital, and that's when the rest of the wounded came. From al-Ahli to Shifa as they were brought in. And then when we had triaged and stabilized the patients and sent them up to the operating room, I went in and rejoined the burns unit at Shifa Hospital.